Okay, so we're going to practice some 360-degree breathing, we call this now. So opening up the rib cage, allowing the diaphragm to move down a little bit, and opening up to the sides and the front and the back, rather than just belly breathing. Yeah, so you may have practiced deep breathing before and focused on really blowing the belly up like a balloon. And after pregnancy, we want to try and avoid doing that too much, because we don't want to put too much pressure on the connective tissue at the front or on the pelvic floor. So as we breathe, instead, we want to focus in on opening up the rib cage to the sides and back and front. So the stomach muscles and the pelvic floor will relax a little bit. We do want that to happen. That's normal breathing mechanics. However, I really want you to focus on this opening up of the rib cage.
That's why we've got the band, isn't it?
Yeah, so the band is giving you a little bit of feedback there.
Okay.
So you've wrapped the band around and you're holding it here. So you're going to pull it so it's a little bit tight, and then we're going to make sure that our shoulders are really relaxed before we take a big deep breath in. We're going to tuck the chin, just extend through the top of the head. Do you feel comfortable?
Yeah.
Yeah? Okay, so if we take a breath in through our nose, keep our mouth closed, and focus on feeling that band separate, and then exhale. Make sure all of the air is out. Don't worry if there's a little bit of dizziness. And then inhale slowly, feel that band expand. Imagine your ribs blowing up like a balloon, or your lungs blowing up like a balloon, your ribs opening. Good. And one more, inhale deeply, and exhale. Okay, excellent. So that's the first part of this technique, and that might take you a while just to get that right first. Then, what I want us to focus on is linking that movement to a pelvic floor and a deep core muscles activation. Okay, so we're going to do two things. We're going to change the out breath to we call it an S breath. So it slows down the breath out, and it sounds like this.
Like a snake.
Yeah, excellent.
Sorry, speak to Stan.
So when you inhale, you did that perfectly. Make sure anyone practicing at home, we're not going a sniffy breath. It's more of a coming from down here. Do you feel the difference between the two? Yeah. Excellent. So this time you're going to inhale, feel the bands separate.
Yeah, this is really good actually, because you really can feel it getting tight and then feel it loosening off.
Excellent.
Release all the breath.
And then as you exhale this time, we want to lift the pelvic floor. Now, me just saying lift the pelvic floor, does that make any sense to you right now? So you know.
I know, but yes, explain please.
After pregnancy, would you know in the first time?
No,
so
not before.
We're often told, aren't we, to do our pelvic floor exercises, but actually knowing how to engage the area, what to do, it's a bit of a minefield. So we often get this wrong. So we find that women either overly engage their abdominal muscles, hold the breath, squeeze the bum cheeks, inner thighs, everywhere but the pelvic floor. So the area that we're focusing on here is we want to think about the area between the vagina and the anus, so the perineum. So we are going to be thinking about lifting that area up rather than squeezing. So a good technique that we use with a lot of our clients is the blueberry technique. So, it sounds a bit silly, but I want you to imagine that you are picking up a blueberry with your vagina.
Okay.
Okay?
I can do that.
So, don't try it at home, it's not a party trick. But I do...
It's a great visualisation though.
Yeah. So
to engage that area, isn't it?
Exactly, and I use a blueberry because what happens if you overly squeeze a blueberry?
You're going to squish it.
Yeah. I don't want you to squish your blueberry, I just want you gently to lift it inside. That's what we're imagining, okay? So as you take the breath in, as you did before, your rib cage is going to expand to the side, your belly's going to relax, and you should feel, hopefully, your pelvic floor relax slightly. So it's almost like, imagine a flower blossoming. You're not bearing down, it's just blossoming. Okay. And then as we exhale, we're going to use this S breath, and you're going to pick up your blueberry. So it's going to look like this. Inhale. And then exhale. Keep hold of your blueberry. Good. And then inhale and let go of your blueberry. Relax that pelvic floor. Exhale. Good. We'll do one more round. Inhale, open up the ribs, brilliant. And then exhale, pick up that blueberry. And you should feel, can you feel the lower part of your abdomen tightening up with that as well? So the movement, if you were to watch the movement here from the side, there's not a huge amount of movement. It's not going inhale and exhale and then sucking in. And the pelvis itself shouldn't move. Yeah. It is the tiniest tightening.
So you shouldn't be doing any of this rocking about.
No. And did you feel towards the end of the pickup that you felt that your lower abdomen, which is your transverse abdominis, it's like a corset muscle, did you feel it tighten?
Yes.
So it's actually easier to learn to tighten that area by lifting the pelvic floor first. Yes. And if you can't feel that, what you can add on to that is another visualization of imagine your two hip bones moving closer to one another rather than up here. You don't want any hollowing of your ribs as you breathe out and engage that core.
Great.
Should we do one more round?
Yes.
Okay. So we're going to relax those shoulders. If they're up here, we can't move this rib cage, so drop them down. Perfect. Okay, so inhale slowly, really expand, 360-degree breathe in, and then exhale and pick up that blueberry. Nice and high, no squeezing at the bottom, no hollowing of the ribs, and then inhale and let it all go. Okay, excellent. If the blueberry visualization doesn't work, you can also think about another one where you're imagining that you're preventing a fart escaping.
Okay.
Nice.
I prefer the blueberry.
It does work though for some people.
Yeah,
so you're just
works.
imagining you're tightening that area. So it's not your typical, you hear a lot of the time recommendations for people to stop the flow of urine, stop going to the toilet. You don't really want to focus on just that area, it's the whole area. So think about that perineum area, lifting up, blueberry, vagina. Inhale, relax.
I like the flower visualization as well, like you say, that kind of blossoming, just gentle, relaxing, and then picking up your blueberry again.
Yeah.
And it's really subtle, isn't it? Because you could do this literally like every evening.
Yeah.
Got the telly on.
Anywhere.
No one would even know you were doing
it. In your
it.
pyjamas.
In your PJs.
So the best place to
use
practice.
Towel, can't you say?
Yeah, if you don't have
these, or you can get these are really cheap, aren't they? So
yeah.
Good to invest in one of these.
And then the best place to practice is first on your back because you've not got any gravity. And then once you feel comfortable with the technique, try it seated, and then you can try it in a box position. So and then that means that you are able to recruit and brace your pelvic floor, abdominals, ready for any movement that we do with our core exercises that are going to come next.
Wonderful.